Autalgia, pain in the ear. See, ear is very unique. Why I am saying unique? Because the small structure, it has got diverse, so many nerves are different nerves are. You will be surprised to know that ear is supplied by 5 nerves, and in that 4 are main important cranial nerves. Totally we have 12 cranial nerves. Out of the 12, 4 supplies the ear also. So this small part being supplied by so many nerves. Why? Maybe it's developmental or evolutionary, maybe. Whatever so, it has got so many nerves. So what happens is the ear pain can be related to the disease related to the ear alone, which is termed as primary otolgia, or it can be disease anywhere else which is supplied by these cranial nerves, and the pain is radiated or referred to the ear, which is called as a secondary otolgia. Now let us see where are these cranial nerves supplied, what are the parts supplied by these cranial nerves. So the pinna alone, this is called as a pinna for your information, and this pinna alone is supplied by the diverse supply. See, the 5th cranial nerve, you have the 10th cranial nerve, along that nearby that area it's supplied by the 7th also, then you have the greater auricular nerve also. And so same thing applies to the auditory canal and the middle ear also, with a small difference. Now coming to the nose, the anterior part is supplied by the 5th cranial nerve, the rest of the part being supplied by 5th and 7th together, and the sinuses by the 5th, and last sinus phoenoid by the 7th, nasopharynx by the 9th, oropharynx again. The nasopharynx means the part behind the nose, oropharynx means part which is behind the tonsil and the part behind that, that is supplied by 9th, and this uvula is supplied by 7th. I'll come to the tongue. That is, tongue anterior part is supplied by the 5th, and posterior, that is the base of the tongue, is supplied by the 9th and 10th. And the voice box, foot pipe, trachea, lower down to the cardiac, all supplied by the 10th. So if you have problem in any of these areas, starting from nose, nasopharynx, you have problem in any of these areas, it can be referred to the ear. The common presentation, if the pain is not related to the ear, after that the most common one is dental, which is supplied by the 5th. So the anterior part of the tongue, the dental, the wisdom teeth, all together, that's what I mean, the floor of the mouth, everything is supplied by the 5th nerve. So they may complain of tooth problem, and they may say they have the ear problem also, ear pain also. So when you examine the ear will be absolutely normal. So it's only a referred pain. If you take care of the dental problem, this ear pain will go off. So in a single diagram, I like to tell you that the ear pain, it can be referred from any of these areas. It may be from the 5th nerve through the oral cavity, that is the anterior part of the tongue, teeth, base of the tongue and all. It can be from the 10th nerve, which is supplying the voice box, foot pipe and everything. And it can be from the tonsil or behind that area, which is called the oropharynx, and the nasopharynx also, to the 9th nerve. Cervical through the C2 and C3, it comes from the neck, and from if there is severe viral infection inside the ear, it comes from the 7th cranial. So we have to examine all these areas: nose, behind the nose, everything, the head and neck, everything has to be examined to come to a diagnosis, to know what is the cause of this otolgia, when we don't find the cause in the ear. That is mainly for the secondary otolgia. More so, this is important, especially if the age is more than 40 or 50, because one of the main causes for secondary otolgia is malignancy. It can present as depending on the site, it can present as that presentation can be different. Say suppose there is tongue lesion, you can have a growth and can bleed. Suppose there is a lesion inside the voice box, there can be change of voice. Along with that, you may have ear pain also. But mind, sometimes they will not be complaining of the throat at all. And when you examine, you find it out. The main complaint will be only ear pain. So examination, Just like how I have mentioned, we have to examine the whole area, and to help us we have a flexible endoscopy by which we can examine the nasal cavity, behind the nose, behind the throat, up to the vocal cords, up to the voice box. And the tongue part can be examined directly, and the base of the tongue with the help of the flexible scope. If in spite of doing all this, when we are not able to, a simple blood test may help us to know whether it's a bacterial infection or viral infection. It may help us to find out. And if it is ear related, hearing test and along with a pressure test in the middle ear, it may help us. And flexible scopy and endoscope I have already mentioned. After primary otology, in secondary otology, the commonest complaint will be because of dental. So, a orthopentomogram, which is a single X-ray which shows all the tooth, can be seen completely. That can help us. Likewise, if all this has been done and in spite of that we are not able to, and the patient is little aged, let's say he has crossed about 50s, and we still suspect there is something which is inside, which is troubling him, a CT scan of the head and the neck can help us. And it can sometimes localize the area, and if it happens to a soft tissue, we can go ahead and do an MRI, and if it happens to a blood vessel or something, we can go ahead and do an MRI for it. So these are the investigations. Why I am telling you this is, ear pain alone, sometimes what happens if it is secondary otology, it cannot be neglected. So we have to go ahead and do all the investigations and come to a diagnosis, especially when we don't find a cause in the ear. So till then, till we come to a diagnosis, we will not be able to treat it. So till we come to a diagnosis, we advise them soft diet, warm fomentation of the ear, and some analgesics. So as soon as we come to the diagnosis, we have to treat as per the cause. So this is all about otology. Thank you so much.